Hi, this is Dr. Grunch. If you're watching this video, I'm sending you this because you had a lumbar disc replacement, and I wanted to go through the do's and don'ts and the post-operative guidelines that I have for this type of procedure. If you've had an L5-S1 disc replacement, your incision will be like a C-section incision across this direction across right above your pelvis. And if you had an L4-5 disc replacement, your incision will be up and down beside your belly button, kind of like this. There will probably be a dressing on top of it. You can peel that off the first time you take a shower, and you can take a shower in 24 hours after surgery. After surgery, you'll wake up in the recovery room, go back to the floor. I usually keep people overnight after this just to make sure your pain's controlled, that you're eating and drinking okay, that you're walking okay, and all those kinds of things. You should be able to go home on post-operative day number 1 or the day after your surgery. There's no brace that is needed. You can wear abdominal binder if you want something to kind of brace that stomach area. I usually do a tap block, or anesthesia will block the abdomen with some numbing medicine in the pre-op holding area. And that will wear off in 12 to 24 hours. So it's normal for the belly to kind of start hurting at that time. It's also very normal to have some back pain and hip pain. If you've had prior lumbar surgery, like a discectomy or a decompression in the back, sometimes the nerves can have some scar tissue around it. And if we do the disc replacement and increase the height of that disc, those nerves can stretch a little bit. And you can even get some radiculitis or pain down the legs. And you can even get that if you've not had surgery on your back before too. And that's normal. If it seems to be severe, please call and ask me or let us know. But some of those symptoms are intermittent and will kind of settle over time. I will give you prescriptions for a pain medicine. That's usually a narcotic you can take as needed, a muscle relaxer that you can take as needed. And then I want you to take an anti-inflammatory medicine. I usually prescribe meloxicam, 15 milligrams daily, and I want you to take it every day for 30 days. Alternatively, you can take a baby aspirin, 81 milligrams every day for 30 days. If you take any blood thinners, you will need to hold that medicine for 7 days after surgery, then you can resume it. In terms of the abdominal pain and the back pain, I talked about that, but you may also notice some swelling of your legs. We do retract the veins, particularly if it's L4-5, you can get some swelling of the legs, and I encourage everyone to keep their legs elevated when they're sitting around and to wear compression socks when you're just, for the first month or so after surgery. Compression socks are great. You can get them on Amazon, or I have a website that you got in your surgery packet that you can purchase them from. But I think those will help with leg swelling, which will help expedite your recovery. You can walk around. I don't want you to do the BLTs. No bending, no lifting, no twisting. So no bending over at the waist, no side-to-side twisting like mopping, vacuuming, tennis, golf, and twisting, rapid twisting, that kind of thing. But, routinely turning around to like put on your shoes, bend over to put on your shoes, wipe your bottom. Those are all normal. We talked about showering. See what else. And then, I don't want you doing any high intensity exercising for 6 weeks. I don't want you running or any activity where you be like kind of plopping down, and that means going up and down stairs aggressively for 6 weeks. Just any impact jarring of your spine. We don't want you doing that because that implant needs to kind of settle and heal appropriately. You want to eat kind of softer foods, bland foods for the first few days after surgery, because we went in the abdomen, and you may just have a little bit of a distension gas, and the belly may be kind of slow to wake up. You get a catheter during the surgery, and we usually remove it right afterwards. So the first time you pee, it may burn a little bit. That's also normal. You'll have a post-op visit with us in 5 or 6 weeks out for surgery with one of my physician assistants, and we'll get x-rays at that time, and we'll check on you. If you have any questions before, please call the office, particularly if you notice any concerns about the incision, any redness, swelling, pus, or anything like that. These are low risk for infection, but always things that you want to call if you have any concerns. In terms of resumption of activities, at 6 weeks, we will have you start to lift more like 20 pounds max, and then at 12 weeks, you can start doing more high impact stuff and more weight lifting, depending on how we think we're doing at those post-op visits. I only need to usually see me for 6 months out from surgery, and we'll get periodic x-rays. But if you're doing well, you don't need to. If you're from out of town, we can try to coordinate some of this over a telehealth. Just let us know. But I'll send you a separate video kind of explaining your personalized case, but this is my general return to activities after a lumbar disc replacement. This is a great procedure. I hope it does well for you. And please let us know if you have any concerns.